So, hey, Dr. Austin, Dr. Lewis here, and I'd love to chat with you about you're the mushroom man, and we've been using, on your advice, medicinal mushrooms for our chronically ill and chronically affected individuals with really good results. You know, autoimmune diseases, chronic infections, fatigue, things like that have been resolving when we use this as part of our cocktail. But frankly, I'm going on your advice, and I'd like to learn today a little bit about these mushrooms individually and what they're renowned to do. So maybe you could start with my favorite, which I take regularly, which is Cordyceps.
Cordyceps is an interesting mushroom that was discovered in the highlands around China, Nepal, and Tibet. And the Tibetan yak herders would bring their yaks up into the high grasslands during the summer season. And these little mushrooms would seem to be sprouting out of the grass. And they noticed that the yaks that grazed on this grass that had these mushrooms became more vigorous and more amorous, strong like bull.
Yeah.
And when they dug down to look at these mushrooms, they found the mushroom was not coming from the grass or the ground. It was actually sprouting out of the head of a caterpillar. The Tibetan ghost moth caterpillar crawls through the grass, and if it gets infected with these mushroom spores, when it dies, the mushroom sprouts out of the caterpillar's head.
I must say that makes it a little less desirable to consume, but you've shown in your practice that free testosterone goes up when you take the Cordyceps. Is that correct?
Traditionally it's been it was sold to the Chinese at very high price, and the wild version sells for about $2,000 an ounce. Fortunately, nowadays we have there are companies who can cultivate the Cordyceps in vats, and it has the same chemical profile as the wild type. So it has a number of benefits, and traditionally has been used in traditional Chinese medicine to stimulate libido, decrease fatigue, and help with pulmonary problems, and also has some anti-cancer properties.
Now, has anybody, like I'm a cyclist, so the UCI, have they put Cordyceps on the banned substance list as a PED, performance enhancing drug?
It increases the VO2, so it increases your ability to exchange oxygen. So that's a good thing. You had the animal study showed you had to use pretty high dose, and the effects were small but significant.
Don't encourage athletes, because when they heard about lactic acid, everybody was taking an acid, which obviously didn't work. But the other thing I heard about Cordyceps, and it's hard to find good literature on the study of these things, but Mycoplasma pneumoniae is a fairly ubiquitous intracellular organism that's hard to treat, and we don't want to give antibiotics to everybody, but Cordyceps apparently has some efficacy against this organism.
That, and many of these medicinal mushrooms have a broad range of antimicrobial and antiviral properties. And, so another one of these organisms that, we've been trying to treat is the chlamydia pneumonia. So that's something that can be treated long-term with antibiotics. Chlamydia pneumonia can cause mainly vascular inflammation and other diseases in a chronic state, and can be a cause of adult onset asthma. But it's difficult to treat. So it takes long-term antibiotic use. Antibiotics have a lot of side effects. And what I've been using in my practice is a mix of 6 different medicinal mushrooms, including Cordyceps, but also Maitake, Shiitake, turkey tail, Reishi, and a mushroom called Agaricus blazei. And when you combine these 6 mushrooms together, you get a synergistic effect that has it helps balance the immune system, and I've seen it fairly consistently lower the titers to the chlamydia pneumonia. So it helps reduce the infectious burden, and I see people get healthier. That combination is one I also use for treating the flu. So I see it take the flu from 6 days down to about 2 days. I rarely see anybody, if I give them this product that helps assist their immune system, which is a mix of 6 different medicinal mushrooms, they often have pretty miraculous recovery from.
I have many testimonies from this where people say that I normally get around a sick child or go to an event, a family event with someone sick, and I always come home sick, and now I don't. So it's really quite miraculous.
I've had a number of positive feedback where, so this is something where if somebody's sick, we put them on high dose, usually 3 grams twice a day. But if they're well, we'll have them just take a gram and a half every day to for prevention. And I had a friend who travels to Germany, like every 2 months. Every time he would get on that plane, he would get sick, either on the way there or on the way back.
Right.
We started him on this product, and he's yet to be sick.
Now, Dr. Tremp, my colleague at Harvard, told me one time, I was talking to someone in the hall, and he came by at his clinic, and it was a Chinese gentleman talking about Chinese herbs. And Dr. Tremp ushered us both into his office and brought out 2 thick leather-bound volumes on Chinese herbs, what their active ingredients are, and how they might interact with pharmaceuticals. So when we look at Chinese herbs, they're very potent medicinals, and in some ways, natural pharmacological agents. So what is your view on their safety profile? And if someone is on existing pharmaceuticals, what do you do to make sure that these medicinals, especially when you're given a combination of 6, aren't going to interact with what their medications are that they might be on? And naturally, we want to get them off their medications, but that's one of the reasons why we're using these.
Well, I'm just beginning to learn a little bit about traditional Chinese medicine and Ayurvedic medicine. And that's one thing I like about the medicinal mushrooms is they seem to be very, very safe. I've yet to have any kind of significant issues using these medicinal mushrooms. It's because they're foods. Would you tell somebody don't eat an apple because it could interfere with your, it's
grapefruit, for example, increases pharmacokinetics, but yeah, I mean, obviously when I asked you about oyster mushrooms, I'd like you to comment on oyster mushrooms and their blood pressure controlling effect. I said, where do I get them? And obviously in your store, and then you say you go to Whole Foods or someplace like that, or go out and pick them.
Yeah, and to clarify, we don't sell to the general public. We because of FDA exemption rules, we sell. I only provide these herbal things to my patients. But yeah, so the oyster mushrooms are something that I'm a huge fan of. That's how I kind of got started in natural medicine. Tom, I used to, as you know, I just used to do standard Western medicine, writing scripts, and then I saw my parents go down the tubes and how they were not responding to Western medicine, and I started getting same things they had with blood pressure issues and things like that, and I had to go on blood pressure medication. I didn't want to do it. I got side effects. I started looking for other options, and I found studies suggesting that oyster mushrooms can lower blood pressure, particularly in people who are diabetic or pre-diabetic. So I started going in the woods and gathering mushrooms and eating them, and within a very short time, within a month, I was off the blood pressure medication. My blood pressure was normalized, and that made me, kind of a believer. And so I started trying to spread the word. And
now, when
nobody wants to go in the woods get mushrooms, so I had to find ways to get it to them.
But when it had that effect on you, did you drop your blood pressure medication? Were you on blood pressure medication and had the mushrooms? How did you actually?
I took them both concurrently, and I don't remember if I stopped the blood pressure medication like 2 weeks later or if it was 4 weeks later. It was something in that time frame, and that's what I generally do with my patients. And where we have good results, if somebody is newly diagnosed hypertension, they come in, they've been placed on lisinopril, I'll start them on the oyster mushrooms and also talk about dietary changes and so forth. And then have them keep a blood pressure log when they're taking both their blood pressure medication and their oyster mushrooms. And we see how, make sure that it's staying controlled. And then we do a taper. So if they're on, 20 milligrams of lisinopril, after 1 month, we'll go to 10. And we keep watching their blood pressure. And they have instructions if their blood pressure, jumps up or is not controlled, they go back on the blood pressure medication. Because we like to do things, slowly. You don't want to, do things real abruptly. These natural medicines can be effective, but they often can take time. Whereas the synthetic prescription blood pressure medication may lower blood pressure very abruptly, usually within a day or two.
Now, let me ask you a question. Of the 6 mushrooms that you normally prescribe, I know a medicinal doesn't have just one mode of action. There's probably multiple things they're doing. providing fiber, providing, prebiotic, any number of things. But can you kind of like just bang down the six and give the highlight on what each one does? We've already done cordyceps. It's somehow affecting hormone production in a favorable way, at least in men. We know the oyster mushrooms have maybe some effect on the kidneys, which is ultimately the regulator of our blood pressure. Maybe it's clearing the kidneys, it's cleaning up the nephrons and allowing things to be restored to normal in terms of filtration rate, and so, but some of the other mushrooms like the reishi.
The reishi I'm a huge fan of, and I often use it as a standalone treatment for a broad range of autoimmune disorders. And I've also, so things like rheumatoid arthritis, along with the cod liver oil, rheumatoid arthritis, and many other autoimmune, Hashimoto's, thyroiditis, Crohn's disease, ulcerative colitis, any of these autoimmune disorders, it seems to either have a profound effect or some significant effect. I also have found it very beneficial for fibromyalgia. Within a month, they're seeing significant improvement. Irritable bowel syndrome, I had a staff member come to me and say, "Hey, I know you're doing the natural stuff. What do you have for IBS?" And I said, "Well, the reishi mushroom. There's a study in mice that showed that it alters the gut microflora in a beneficial way, so you have less gut inflammation." So we tried it out. A month later, she said, "This is the best stuff ever for IBS. All my bloating and cramping is gone. My bowel patterns are normal." I started using it for other people, and it's been fairly consistent results. I'd say probably over 90% are markedly improved within 1 month.
Yeah, this is a generalization, but I just recently read a study from an authority on gastrointestinal disease, and I interviewed Thomas Barodi, who's one of the top gastroenterologists in the world. He was involved in the H. pylori discovery of connected to stomach ulcers, but there's no question that the depth and breadth, so it's the number of types of organisms and the amount of those organisms in your gut are very different in people with no chronic disease versus those that have chronic disease. And obviously, if the ones with chronic disease have a much smaller range and much fewer of them, of the beneficial bacteria. So clearly the mushrooms must be playing, we can only assume, but must be playing a role in promoting a healthy microbiome.
Yes, they're shown to do that. They have beta glucans. So there are these things. Beta glucans are kind of it's kind of like a carbohydrate kind of molecule that has a number of beneficial effects, and they kind of act like a prebiotic. So the reishi is one of those I use a lot. The oyster mushrooms we talk about help with blood pressure, but also can help with blood glucose metabolism. I have used them as a treatment for eczema, and they often work well. The reishi can help with psoriasis and other autoimmune disorders. The Maitake has anti-cancer compounds and also stimulates and balances the immune system. Shiitake, similarly. Agaricus blazei has anti-cancer properties. There was a study showing people who ate that mushroom had half the cancer rate of the people who didn't. It comes out of Brazil. It's a Brazilian mushroom. And when you take these multiple mushrooms and you mix them together, you get a synergistic effect that's way above and beyond anything you get from a single mushroom. There was a study, they studied that mushroom combination, those 6 mushrooms, not the oyster, but the other 6, it was a very small study in Africa with HIV patients. And what they found was after a few months, their CD4 count came up quite significantly, often up to normal. So they were using it.
What is CD4 count?
It's a marker that's used to assess disease progression in HIV or AIDS patients.
Fair enough.
And they were using it as a standalone treatment for HIV, and it worked. I'm not advocating that. I think we have excellent prescription medications here for HIV. That you want to go with something that where the data.
So yeah, cod liver oil was shown in studies 100 years before antibiotics were available to reduce mortality from infectious disease like tuberculosis. So it's not a completely unexpected thing that something natural can be antibiotic. So
I think there's where the natural compounds excel are where Western medicine has failed. So I'm licensed to prescribe medications. I'm not opposed to prescription medications, but you want to weigh the risk and benefits and make an objective decision. But in those cases where we don't have anything approved for the condition, like the novel coronavirus example, or the things that are approved really don't work very well. And an example there is, the fibromyalgia or irritable bowel syndrome. It makes sense to think outside the box and look for other options. I'll tell you, I had a gentleman who presented with a rare condition, eosinophilic vasculitis of Churg-Strauss. And, I'd only read about the case in medical school. I'd never seen a case. And he had skin lesions and he was having end organ damage. And it was just, it was recurrent asthma. And this syndrome, it's not very well understood. There's no good prescription medication. Sometimes prednisone is used to suppress the whole immune system. That's like using a sledgehammer to drive in a tiny nail. But just knowing that it raises blood eosinophilia, that disease process did, I put him on a combination of oyster mushroom and reishi, knowing that the oyster mushroom lowers blood eosinophilia and has anti-allergic effects, and then the reishi has also some anti-allergic effects. And he had a profound improvement. His eosinophil levels went from 3,000, I forget what they were, I think it was 3,000 or 4,000, and they dropped and successively, and within about 3 months, he was back down to normal as the eosinophil level, his skin rashes cleared. Yeah. It was amazing.
Eosinophilia is usually associated with some sort of a parasitic infection.
Parasitic or like asthma, allergies. Yeah, it's an immune system dysfunction. So again, so we don't know what causes eosinophilic vasculitis of Churg-Strauss, but it could be some kind of parasite that we don't know about. So,
right.
Sometimes we don't.
I mean, I'm
not a researcher. I need to get people results. And that's why people come to see me. When you come see somebody called Dr. Mushroom, you have to be desperate. But a lot of times we get some results from people, and that's why they send their friends.
Yeah. Well, just to be clear, Dr. Austin, you run urgent care centers, but your passion is your natural medicine practice.
And I have an interest also in helping people with neurodegenerative disease. And so I'm happy to, particularly Parkinson's disease, I've got some things I'm using that where we're seeing very exciting improvements in the Parkinson's patients. So if somebody lives around close to me, I'd like for them to come into my office. But if they do not live close to me, I'm happy to do a telemedicine or telephone consult for free. I'd like to, and hopefully I can get a free will donation for that if they get some improvement. But I want to help people. I want to turn people on to these natural medicines that can help them. And perhaps we can do a separate video about the Parkinson's.
I think we should do. We could even do a 3-way on the Parkinson's.
Yeah, with a patient testimonial. Yeah, that'd be excellent.
Yeah, if you have folks, and I know you do, so that'd be great. So, hey, great, Dr. Austin. It was really good learning about the medicinal mushrooms. And to summarize, you have a range of mushrooms. You generally have seen that giving more in a combination of 6 provides you much better efficacy than a single mushroom. My favorite is Cordyceps because it seems to boost my energy and my libido, so that's always a good thing. Yes,
I've had a lot of positive feedback from people who've used that. I think the quote I like from my friend, he says, we had tried to use it to cure his ringing in the ears, which it has been used traditionally for that. It didn't work for him, but he said, this stuff makes me feel like a man. So, that's a good thing, I think.
There aren't a lot of drugs that can make the same claim, at least without the side effects.
Right.
All right, Dr. Austin, thank you very much for your time, and we'll catch up again and talk about Parkinson's.
Okay, take care.
Take care. I know.